My name is Regina. I'm a sculptor and I also make jewelry. Part of my process as an artist is working with found metal scrap, just an old piece of junk that was laying on the side of the road or something that maybe it's not really clearly defined in my mind when I see it, but I see something in it. There's something about taking that discarded metal that was destined for a landfill and really turning it into a thing of beauty. It's analogous to finally being able to move into the full expression of who I am as a human being in this world and to live my life authentically. I was a child when I first became aware that there was something about me that was different, but I really didn't know what it was. When I first fully realized that it was gender, I was in a parochial school at the time, probably 8th, 9th grade. All my life, I had accumulated an identity that was not genuine to who I really was. I knew that I had to do something, but I really didn't know where to reach out. And actually, the first organization that I reached out to was the Gender Identity Center of Colorado. They set me up with a therapist. They came to their own conclusion that I did have gender incongruence and that transitioning was the appropriate thing for me. So that basically started me on my transition journey. I reached out to my primary care provider, the doctor that I had had for almost 20 years, and he said, I really don't know what to do for you. I can't help you. As far as insurance is involved, there really wasn't any. They wouldn't cover any of my transition-related health care. I found myself divorced, unemployed, was living on my own, trying to find work, was burning up the savings that I had. I was spending about $1,000 a month on the medications that I need. It ended up getting so bad that I started charging my medications on credit cards to the point where I ran those up. And when I couldn't run those up anymore, then I started cutting my dosages. So I started taking half of the medication that I need, and of course, I started having problems with my asthma. I started volunteering at the GLBT Community Center of Colorado. They were telling me about some of the nuances of the Affordable Care Act and how it might work for me. I had heard the president say that there wasn't going to be any pre-existing denials because of pre-existing conditions and whatnot. And then I'd also found out that you need to include transgender-related healthcare in your policies if you want to do business in the state of Colorado. As it was rolled out, since the GLBT Community Center of Colorado was an assistance site, I was able to connect with one of their healthcare navigators who sat down and helped me to select a plan. I felt like I'd been resurrected, almost like I could breathe. I could breathe financially, that I could finally get a plan that I could afford that would cover everything that I needed. Today, my overall health is excellent, I'm proud to say. The ability for me to transition has allowed me to move into the full expression of who I am as a person in this world. It is second only to the birth of my children. And the Affordable Care Act has saved my life. My children have me today because of the Affordable Care Act.